Hi, my name is Mike, and I'm a professional business person, obviously, in America, and I'm making this video in regards to trying to find a solution for the healthcare. I believe it's a lot simpler than everybody's making it, but due to the politics and the lobbyists and the government, I believe it's harder to come to a solution than it really should be. I believe one of the main things for our healthcare solution would be to provide benefits to individuals, therefore medical care when needed and without discrimination. It's going to be kind of an informal way of going through this, but there's some just simple key steps that need to be in there. And one of the biggest problems is of course, getting healthcare has to do with maintaining quality of life and what people should actually get. One of my true concerns is anybody protecting my benefits while making these decisions to provide health care to everyone. Do I believe everybody should have health care? Absolutely. It's just the amount of health care that should be provided because somebody has to pay for it. So in the business world or in most decisions in life, what you try to do is accomplish it in the best way that makes sense and is practical. Again, we want to provide medical care, protect benefits to individuals, and we want to do this without discrimination. And one thing that I've enjoyed over the last 16 years was I have had insurance. And one of the best freedoms that I've had is that I haven't had medical insurance with any company or through a business that has hired me. And it has been great. So that's one of the first things I would say. Instead of putting this burden on the businesses, individuals should carry their own health insurance. And this would eliminate a lot of problems. One is it would allow you to be able to quit your job without the repercussions of what am I going to do? I've got to stay here in order to keep it, maintain it, and so on and so on. There would be no lapse in coverage. When I did switch jobs, I wouldn't have to wait another 6 months or a year or whatever in order to gain the benefits. And then what happens if something happens and the business gets rid of me? I could have a lapse in coverage for months or years. The third great thing today would be that right now businesses don't know what to do, and the expense of hiring an extra individual with what unknown policies are coming makes it tough to hire somebody. So we take that burden off the business and in turn allow everybody to get health insurance. And this comes down to the basic principles of you can't redline, you can't discriminate, and you can't refuse coverage to anybody. Now, how do you do that? To put it simply, I think there's a couple things that have to happen. You make a good, better, and best kind of adoption to health insurance. Everybody gets good. That's kind of where we're going with the healthcare plan as it is. We want to give coverage to everybody. But everybody can't have an infinite amount of health coverage. Somebody has to pay for it. So we go back to the good, better, and best. We set amounts on those different levels of tiers. People that can't afford health insurance at all could still have some form of subsidy to get the basic levels of insurance. And that's basically what anybody really wants. They don't expect everything, nor should they, because everybody can't have everything in an infinite amount. Because if you do that, you're not protecting others. Our government's not standing up for us to provide benefits to everyone and protect those that should be getting the benefits. Those individuals should be protected to be able to have health insurance. Now, how do you kind of break this down? One is you got to set an amount of health coverage that you're going to allow an individual to have as a right or entitlement in America. We're already there. We believe everybody should have it, but there has to be some limit. And then there needs to be some kind of limit or lifetime coverage associated with that. Yeah, it's a tough one to go with because everybody believes they should have an infinite amount, but the reality is they don't. So if X amount of time you can't be cured to a point to where you can maintain. These are tough decisions, but they're decisions that everybody needs to make, and it's just the way of life going back to all species. It's a tough one. I'm not going to deny that, but at some point, you can't put $50 million into everybody. So we work through those concepts of setting amounts, lifetime coverage. Even my current policy, I'm allowed $3 million in my lifetime. So we've got the good, better, and best. Then also in a part of this process, we would allow cross state lines to increase the competition. We open it up to everybody. Everybody gets the basic. And then if you want to pay for a better level of coverage, you want to pay for the best level of coverage you can. If you want brain surgery, great. Personally, I don't care for brain surgery. There has to be limits. I would be more than willing to have basic coverage to go see a doctor, be able to go in the hospital, get simple coverage and all that. And at the point in time, if we set the limit at 3 million, 5 million, you want to give everybody 10 million, whatever it is, but it all comes down to numbers. And I am a numbers guy, and that's why I understand this probably more so than others. After that, we would then also have to do tort reform. Tort reform would obviously allow a lot of these expenses to be handled better. You wouldn't have frivolous lawsuits. Everybody would be guaranteed coverage up to their limits. And this would then allow the system to work better in regards to controlling costs and allowing everybody to have better coverage. Hey, if we can save a lot of money, maybe we can increase our coverage down the road because of this. Should doctors or whomever it is that is malicious be able to get away with things? No, but that's where we talk later down the road about an accountability website, and we'd be able to measure and have informative information in regards to what's going on out there, and that would therefore make our choices or help us make better choices in regards to what kind of care we try to get. This kind of tort reform and these kind of actions will allow us to drive down medical expenses. A lot of the expenses that we pay to these doctors, and if you look at their salaries, they're really impressive, and I have nothing against doctors or people that are making money, but they would make the same amount of money if there was tort reform and controls of these costs. So that's basically what it is. We're trying to provide health care to everybody. We're protecting the benefits of the people that are paying for their health care. And we're doing it without discrimination. And you could go get coverage for whatever you want. If you're allowed $3 million of lifetime coverage, you could go get chiropractic care. You could go to dermatologists and stuff. You could even get dental care. You could spend it however you need to, but there has to be a cap, or otherwise there will be discrimination, because you're going to be cutting benefits of somebody like myself or others in order to provide for care that you've got to question, is everybody entitled to get. We live in a great country. If you wake up tomorrow, or you're born into the country, and you know you got $3 to $5 million of medical health care in your lifetime, you should be proud of that. You should be great with that. But again, you should be able to use it without discrimination and other issues. And again, by carrying your insurance by yourself, you'll have more control of it. Do as you want with it. And this would also take the burdens off businesses, which in turn, then they can hire and do what they do best, make profits, hire people, individuals, and provide jobs. And this would allow us a system that is sustainable into the future. It makes sense, that could be studied and provided for while protecting every individual's rights and benefits without causing increases in taxes and increase in programs just to pay for it, because we already know what it is. And again, if you can provide or benefit, or you can pay for more, you can have endless amount of health care. We can always have studies that allow people to go to certain groups that are funded by these organizations that will provide future greater gains of health care, but that would be outside the scope of what it is, and there would be no reason for the complaints, because you were given your allotted lifetime limit of coverage to cure whatever ails you, and you could spend it however you want. Audits could be done in the future to make sure everything's done correctly and everything, but again, this is a rough simple scenario of how to provide health care to everybody on a fair, non-discriminating, non-redlining basis. What's hard about this is the special interest in games that are being played by our governments and others that will not allow this simple scenario to play out and make it practical for everyone. Anyhow, I hope this wasn't too convoluted, not very professionally set up, but it is a very simple scenario, a very simple analysis of how to provide health care to everyone on a basic level of need and not discriminate on what you are essentially entitled to according to the American ways. Anyhow, good luck and God bless.